About the tissue level of a Bright implant system, the Bright TL have a unique external connection system with a 20 beveled inclined external connection system. Have one platform, 3.8 diameter, is a very benefit to have one prosthetic connection. And have a 1.5 gingival height, the smooth surface on the body at the top portion of the fixture, and have a thin and deep thread design, and sharp thread gave us a higher initial stability when we have insertion into even though the soft bone. What about osteogenocollagen? This one is one of the collagenated bone. The origin is osteogeno. Osteogeno means bovine bone origin, bovine cancellous bone origin xenograft. 92% of osteogeno and 88% porcine Thai bone collagen. This Thai bone collagen holding the particulated bone, so this collagenated bone gave us a lot of benefits and versatile on the application. This osteogeno could be applied on this area, GBR procedure and contour augmentation and lower and upper, and also ARP on the extraction socket. Also, these graft materials will be applied on the sinus elevation procedure. Especially when you have a crystal approach, this osteogenocollagen is much better to have the sinus elevate through this osteotomy site. For example, the soaking the saline, the make small pieces, and pick these small pieces, pick it out, and then push it into the sinus cavities, and also combined with the compaction drill from the Dask Simple kit, and very simple, the sinus elevation will be performed. Okay, the last recipe for the easy bone graft procedure, collagen graft. This collagen graft is highly pure Thai bone collagen matrix from the porcine tendon. So this collagen graft gave us the benefit for using this GBR procedure, and sometimes contour augmentation or the soft tissue augmentation. This collagen graft is used the rich preservation, soft tissue augmentation, the recoverable keratinized mucosa, and the root coverage. The very versatile the graft materials. Actually, this collagen graft is a substitute, can be used to substitute the connective graft, CTG, from the patient mouth. So the namely palatal-free concept will be performed using this collagen graft material. Okay, let's move to the surgery video today. Before extraction, actually Dr. Zhang is starting to have cutting the gingival fiber from the root surface using this explorer, helping the easier extraction without any trauma.
측절치에다 하고 콜라겐 그래프트로 해도 될 것 같죠? 커버가 되니까. 중절치 부위는 오히려 꺼지는 것도 좋을 것 같죠? 이게 밖으로 돌출돼 있기 때문에.
So Dr. Zhang is going to have some socket preservation on the central incisor area and two implant installation on the lateral incisor area as planned before. That is Yeah, good choice and good plan. Cause of due to the previous intraoral view, you can see clear this central incisor have some labial version. So the patient mouth looks like a protruding. So these central incisors are treated with a socket preservation procedure, and the main implant will be installed the lateral incisor labia. That is simple, and the better the aesthetic will be performed. Okay, the simple extraction was performed. This upper four anterior teeth are loosened from the socket already, so extraction is not complicated. The simple extraction and socket irrigation. And what is next? You can guess. The thorough granulation remover from the socket area, and all the granulation, remnant of the granulation tissue should be removed clearly. So you may use the node current, the curve towards the straight node current. I think that Dr. John is same. Okay, checking. Now checking the labial wall. This step is very important to have ARP or immediate implantation. Why? This labial wall, in that case, actually the procedure may be simpler. Just the socket filling, the gap filling procedure, or the socket filling procedure is enough. However, some lectins or destruction of labial wall case, actually we need a GBR procedure using membrane or some other complicate of the procedure. Okay, now the Fisher bar. Dr. Zhang preferred to use Fisher bar, high-speed Fisher bar to make entry point of the socket. Sometimes this socket is easier to sleep with, right? So incline the palatal wall is easy to sleep with. So first of all, Dr. Zhang to make an entry point with a high-speed bar. And then changing the drill, the Lindemann drill, and go straight for the proper position and angle. Generally speaking, as you know, which one is a best entry point of the socket when we have an immediate implantation. As you know, 1/3 from the apical portion of the palatal socket wall is exactly correct, the entry point, right? Cause of natural teeth have some curvature. However, implant fixture have a straight. So this kind of discrepancy will happen. So first of all, initial entry point checking is the first step to have good implant installation. In future, the perfect, beautiful outcome of aesthetic. After initial drilling of Lindemann, I think Dr. Zhang chose 2.5 diameter bright TL system. So the drilling is already done for 2.5 millimeter, right? So now he is compacting the bone graft material, the collagenated bone graft materials, osteogenic collagen. As I introduced before, this osteogenic collagen have the hybrid type bone graft materials, particularly the bone, the holding by the collagen binder. This collagen from the porcine tendon. So sometimes looks like this, the bone grafting first, and then the implant fixation. And sometimes reverse, after implant insertion and then the packing the bone graft. Both of them are available and acceptable. However, a little bit the large socket or sometimes the tight to getting enough initial stability case, bone grafting first procedure, this step is better. Okay, checking the Lindemann again. And here decided the length 11 millimeter, right? So bright TL finally comes out. Here, this bright TL system, external connection, this holder holding the top portion of the fixture, looks like here. And the plastic cap is a protection on the screw hole, a protective cap. And once again, the same size, bright TL was inserted on the number 22 lateral incisor area. Okay, the inserting speed was 50 RPM without saline irrigation, and the depth is good. Okay, the hand tightening and talking again to guarantee initial stability on this area. You can use just a talking tool, the latchet, or you can use talk wrench. So both of them are available and acceptable for to make sure the initial stability. Okay, inserting the osteogenocollagen again on this central incisor socket area. Due to intact labial wall, socket wall, it is stay there, the volume and the texture, the labial texture, without any decrease of the width or some depression because of intact labial wall. Without labial wall case, socket will be collapsed down. So we have to check the before the bone grafting or the implant insertion procedure. So extraction, checking the labial wall and granulation tissues remover. This one is prerequisite procedure to have a proper implant insertion in the bone grafting. Okay. There have some issues we have. First, the connection with digital abutment. At every time when you have insertion of bright TL, should be connected with this digital abutment, depend on insertion torque and the depth. For me, actually, the higher insertion torque over 35 Newton, this digital abutment connection is a necessary part to have an extra the procedure, the easier to get the easier next procedure. However, the lower torque insertion torque case, just leave it insertion and just leave it. Don't leave a plastic cap you just leave it, and then the bone packing or some other procedures will be done, and after that, the suture and leave it until the fully healing side status, and then the removing the plastic cap and insert this digital abutment. That is acceptable. However, now Dr. Jung to connect with the digital abutment because of initial stability. The second issue is depth. When you have aesthetic area insertion, the implant fixture, the depth, insertion depth is very important factor to get the better, the higher aesthetic outcome. So the bone level is the familiar to have a proper positioning, top portion of the fixture. However, this external connection type fixture have some unfamiliar cause of this one is brand new implant system. However, that is the same that is the same level. For example, this bright tissue level, TL have the platform. Underneath this platform, 1.5 polished surface, and then have some thread with a treated surface, right? So from this, the margin, upper part of the margin, 1.8 millimeter. The top portion, from top portion to margin, 1.8. From the margin to polished surface, end of the polished surface, 1.5. This the gingival curve. So totally 3.3, right? So you have some reference line from this line between treated surface and then polished surface. So that is the same level of bone level implant fixtures top portion. So we can guess, we can check the depth of implant fixture to compare to neighbor this natural piece CJ level, right? So we can control the depth of the fixture. That is important part. The depth of implant fixtures cause of the emergence profile, right? So as you can see, these implant fixtures already inserted almost 3 millimeter under CJ of the natural teeth. Okay, so now Dr. Zhang already packed the collagen bone and collagen graft, this extraction socket area, both of central incisor. This central incisor area, the will be punning, right? When we have a final lacerations, implant supported. So just to put the graft material and suture, that's it. For me, when I have ARP, I prefer to have a tight packing of particulated bone. The tight packing of particulated bone from some reason, the stability, fixture stability is important. However, also this graft material stability is also important as well, right? Stability is very important factor at on the cell level. The stability means better differentiation, good differentiation, and then make a newly forming bone. However, unstable situation, the loss of a stability case, actually, it is impossible to have a good qualities of newborn. So I prefer to have a tight packing with the particulated bone, the bottom of the socket area, a little bit tight packing with a particulated bone like osteum geno, And the top portion, the covered with the collagen graft. The collagen graft, 1D, is better to have an ARP procedure, size 10 by 10. That is a perfect size to have a sealed socket area, right? Now, Dr. Zhang have the hidden X suture. This one is internal X sutures, another name. So this internal, the cross sutures, the press underneath for graft materials when we have socket the area suturing. So can you see this suture materials pushing into the socket area? So this internal cross suture, another name, the hidden X suture is better for this socket area with the graft insertion. Okay, both of the central incisor with the socket preservation, this procedure was performed, and the lateral incisor areas inserted with the bright TL, narrow diameter 2.5 millimeter, 11 millimeter length. Okay, the surgery was done so faster, right? So it means bright TL gave us the easier implant surgery, make it easier, okay? We will have a break time, 10 minutes break time, and then I will be back for the next session with the Q&A. Okay, thank you for watching. Stay tuned. Okay, thank you for waiting. This one is post-op intraoral view. As I mentioned before, these areas should be compact filling is better. But anyway, all these areas was performed very beautiful and good situation. X-ray view here, the post-op panoramic view, 2.5 millimeter looks like the smaller on the compared to this socket area. However, after this PA, when we see the convex CT view, you can see clear why Dr. Jung chose 2.5 diameter. Okay, this one is post-op convex CT view. 12 and 22 areas, 2.5 diameter implant fixtures, bodies fully covered by host bone. That is important and key factor. When you choose this bright TL system, this bright TL sharp thread engaged the cancellous bone area. So even though the smaller diameter, the tight engaged cancellous bone, the middle portion of the fixture, that is a strong point, give us strong energy and give us whole bodies surrounded by host bone. So after that, the bone grafting, even though the GBR procedure is make it easier and make it comfort for us. Cause of already done this implant surrounded by host bone, that is a key point. Let's see. Maybe Dr. Zhang may be the select 3.0 or 3.5 diameter. What will be happen? Maybe some thread engage the cortical bone or some the part of implant fixtures can be exposed. So that is not good situation for in future osseointegration and the implant healing period, right? So let's again keep in mind smaller diameter, even though the smaller diameter is enough when you use a bright TL system. Okay, after that, we're going to get the intraoral scan just after the surgery. The same day the surgery, the scanning here using this intraoral scanner, we can get this beautiful image from the scanning. And this one is a CT image. So the merging each other, the CT image and the scan image. And the DICOM file, STL file, the merging each other. And then we can get the better information, looks like here. So we adjust some of angulation in future anterior the teeth prosthesis supported by implant, two implants. So a little bit the lingual version and inside moving to the lingual side on this program. And finally, we can make sure this CT image. Let's see, this patient have some protrusion of the mouth due to this labial version, the loosened teeth from the socket, the upper anterior teeth, as you know. However, when you have prosthesis from the implant supported final prosthesis, looks like here, the panic area is a little bit retrude, looks like here. I think this prosthesis make it better in future, the profile of the patient. Okay, so first make a PMMA after setting up the program and make a PMMA with the scan abutment, this digital abutment. This digital abutment working as a temporary abutment, like a dual abutment from the supine line system. And the connect abutment and the PMMA temporary and the screw hole on the labial portion. However, it doesn't matter. cause of temporary prosthesis. Okay, and deliver this temporary procedure, temporary prosthesis made by PMMA with abutment and deliver to our patient mouse and connect and on this just on the two lateral incisal area. And another key is here. Can you see the middle, the picture, middle, the photo here? Bind the lateral natural teeth with the resin bonded to give some more support on this temporary prosthesis, right? So the adding, the helping this support using the resin bonded natural teeth, neighbor teeth. But that is good concept, like a Maryland bridge style. The design was made by this concept already. Okay, profile of the patient. The lateral profile is getting better, right? So the front profile also, the more comfortable, looks like better. So patient, the happy, the patient satisfied, this profile here. And we will have a final restoration, this level and this contour. Okay, today's sessions was today's session is finished, and we will have a Q&A now. We have we have two questions. Very nice, good questions. Thank you for giving us a good question. Number one, what were the key indications for the immediate implantation? Number two, what type of graft materials do you prefer to immediate implantation and why? Okay, I'm going to answer to number one question. What were the key indications for immediate implantation? That have some issues I have. First one, initial stability, right? When you have immediate implantation on extraction socket, first one, the prerequisite factor is initial stability for the proper position, right? If you can get the proper positioning with enough initial stability case, immediate implantation is first choice. And number two is here, some apical lesion or the periodontal condition. As I mentioned before, some of the lack of labial wall of the socket is like make it the complicated on the surgery procedure. So intact labial wall means a simpler way with just gap filling, the socket filling. That's it. However, lack of labial wall means flap reflection should be flap reflected, and the debridement have some. Sometimes we have two parietal releasing incision to have a primary closure, the membrane fixation. Sometimes we may use pin fixation or the suturing, and the bone packing and suture. There are lots of complicated procedures added, right? And another one issue is here, apical lesion. When you have an apical lesion, our patient have apical lesion case, actually it is absolutely not contraindication, right? That depend on the size. Under 2 millimeter apical lesion case, actually we may go to immediate implantation after removing the granulation tissues on this site. However, bigger case, more than 2 millimeter, actually a bigger apical lesion case, actually it is impossible sometimes to have initial stability or some the dangerous situation, the infection, right? So Finally, I can summarize the key indication for immediate implantation case, actually intact socket, from the accident, like a root fracture with some trauma, or the root canal treatment teeth. However, the failed crown and forced case, that is good indication. And intact labial wall case, the best condition, best indication to have immediate implantation. The smaller than 2 millimeter apical lesion case also available, acceptable to have to get the immediate implantation, right? So indication is here, and the key factor to get the considering factor to have immediate implantation. There are several the indication, the considering factor. However, first one, initial stability with the proper positioning. The second one, actually the angulation, depth, and the distance between the natural teeth and between the implant fixture. The 3D dimensional, the positioning, right? And then the bone grafting with a simpler way. Okay, let's move to number 2 question. I'm going to answer about this question. Actually, I prefer to use particulated bone, right? A particulated bone, the socket, the empty area between the wall and implant surface. When I use this particulated bone, like a little bit the faster resorption and softer and the higher interconnected pore graft material like osteon geno. Osteon geno, even though the bovine source, however, this osteon geno from the bovine cancellous, so a little bit softer, have a lot of interconnected pore. It means faster newborn formation, and also the proper resorption period, resorption time, turnover time means the faster making a newly forming bone when we applied the site. And after that, I try to have the collagen graft sealing area, top portion. The cause of the particulated bone, sometimes dispersed and displaced from this socket, even though the smaller socket area. So I always try to have a collagenated bone or collagen graft to give stability. Even though the bone grafting materials, stability is very important. As I mentioned before, the stability means in future high quality good bone formation, a newly good bone formation, right? The loss of stability, even though the graft materials failed or is a poor condition, a poor quality of newly forming bone. So give a good stability, the particulated bone, little bit tight packing, and above this graft materials applied collagenated bone or collagen graft give more stability, right? And that is why. And all of these conditions will be good healing and fast healing. Nowadays, actually, I prefer to use collagen graft. This collagen graft is both beneficial to soft tissue aspect, actually faster the soft tissue healing, promote faster soft tissue healing to this the bone aspect that actually make some stability. Okay, that is my answer. Okay, please keep in mind once again the stability of graft materials and stability of implant fixture and the smaller diameter. When we have the tight and narrow socket reach area. For this reason, for this purpose, actually bright TL and osteogeno collagen, adding the collagen graft is a best combination for your the easier and simpler procedure. That is today's the lesson. Thank you for watching. See you next time. Actually, next live surgery will be the February 20 at the same time. Okay, thank you again. Bye.